Welcome everyone to today's webinar. I am Jessica Kim Cohen with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the webinar recording to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing one of our presenters, Ralph Erickson. Ralph is President and CEO of Carina. Since joining the team in 2006, Ralph has overseen the company's transformation from a house call company to a virtual healthcare solutions provider with care quality as the core of its vision. Ralph's leadership includes investment in clinical quality in partnerships with leading health systems and Fortune 50 companies to offer high-quality virtual care access to over 18 million consumers. Prior to Carina, Ralph served as Managing Director of Venture Investments at Vulcan Capital, where he was responsible for the firm's technology and biotechnology investments. He co-founded Watershed Capital, an early-stage technology venture fund. Ralph has served on the board of numerous technology startups and has held leadership positions at Starwave Corporation, Next Computer Inc., and Sun Microsystems. Ralph also earned a degree in System Software Science from the Rochester Institute of Technology. Ralph, I'll now turn the floor over to you.
Thank you, Jessica. And first, I'd like to start by thanking Becker's for hosting us today. We appreciate your work on our behalf. And I'd like to also thank Janine Gazelle, our presenter from HSHS, who will be joining us in just a moment. Our agenda for today is really just give you a quick snapshot about Carina and then move into the lessons learned from Janine and her team, the Anytime Care team at HSHS. So briefly about Carina, our mission really is, as an organization, to focus on how consumers access healthcare and how providers deliver it. And we're very deliberate about using the word consumer over patient because, as you may know, a large number of patients that seek virtual care through a virtual clinic are new to the system, and so they're making that decision. They haven't yet become a patient. So we think about our job as attracting and serving those individuals as consumers as well as patients. Our company is a little bit unique. We were founded originally as a primary care organization focused on house call delivery. We use technology to make that house call virtual, and our team is composed not only of clinical professionals and an employee medical group and a group of technology software engineers, but we really pride ourselves in having a team that is very focused on consumer experience. Many of our people came from Amazon, and so they think about the virtual care as essentially as an e-commerce type transaction in addition to being great medical care. As we think about what's happening in the marketplace, we really see two phenomena that health systems are really dealing with. There's sort of two cross currents in the market today. One of those cross currents is that of the forces of consumerism and with the continued change in plan design and the popularity of high deductibles, consumers are more and more looking for healthcare services that meet their budget and their lifestyle and work with their health plan. At the other end of the spectrum, we see health systems struggling to manage risk and deal with evolving reimbursement systems that moving away from fee-for-service type reimbursement to fee-for-value type reimbursement. And that the continuum between those two forces include self-insured organizations that are looking for services that integrate into their care into their plan design, large government payers and commercial payers that are moving to accountable care or other fee-for-value mechanisms. And we're seeing rising competition from non-system-based organizations that are providing goods and services that would have traditionally been provided by the health system, and those are coming from retail and from apps. And so we see the opportunity of virtual care is to give the health system the opportunity to meet the consumer where they are, provide services that are an extension of that health system and reflect that health system's value and patient relationship preferences. So with that, I'd love to turn it over to Janine, and she will take us through her presentation and their experience using Karina's virtual clinic at their health system in Illinois. Janine?
Thanks, Ralph. This is Janine Gonzalez, and I manage the Anytime Care initiative here at HSHS Medical Group. We were an early adopter of the direct-to-consumer virtual care, launching in 2015, and I'm pleased to be able to share what we've learned along the way. In this first part of today's presentation, I want to talk about the ways our virtual clinic design decisions reflect our goals. And then I'm going to shift into some best practices we've developed about the virtual clinic operation. Let me get started by orienting you to our structure and how the virtual clinic fits in. I'm attached to the HSHS Medical Group, which is the physician organization connected to a larger healthcare system. The HSHS system is a faith-based organization with locations in both Wisconsin and Illinois. Yeah, we're pretty big. We have about 15 hospitals and approximately 100 clinic practices, and we're in a very competitive market. Our patients reside in both rural and urban communities. Throughout today's webinar, I'll be talking about our HSHS Medical Group branded virtual clinic, Anytime Care. Karina is our operating partner, but only the HSHS Medical Group brand is visible to our consumers. We offer virtual primary and urgent care on demand to members of the public for a fee in service areas in central and southern Illinois. And most recently, we added access to the virtual clinic to our HSHS system employee population, so that includes our Wisconsin employees. Ralph touched on some of the national trends that are accelerating healthcare adoption of virtual care. Let me show you what those trends look like here at HSHS. The trends that Ralph mentioned are our daily reality. We are consumers in our area are likely to be enrolled in a high deductible health plan, well over the national average penetration of high deductible health plans. Our consumer-insured consumers are likely to be enrolled in a PPO plan, affording them expanded choices about their care. And it's their money that's coming out of their pocket. 44% of them have their own dollars at risk during the entire year, leaving them exposed for even relatively low-cost services. No surprise then that our consumers ranked cost and convenience drivers among their most important preferences when choosing a provider of urgent care. Like many health systems, though, we invested in urgent care clinics to respond to those needs. But it became clear that our consumers demanded even more convenience and better value. For example, 24 hours a day, 365 days a year access. Let me show you how we thought about our goals for the virtual clinic on the next slide. We wanted to respond to consumers' requirements in a way that provided the best clinical outcomes for our population served and meet our business requirements. As we prepared to enter into virtual care, we defined two elements of one overarching goal. We knew we had to extend our brand to communicate the value of our system to consumers and to extend our care. We had to back up the branding with clinically excellent integrated care. Those two elements support our overarching goal of earning new patient relationships. Our goal is to begin or renew a sustainable relationship between an individual consumer and our entire system of care. Defining our goal in this way led us to some early conclusions about the way we would set up the clinic. Working towards this goal meant that we could not simply outsource the provision of virtual care like any other purchase service to a third party. We also know we had to avoid creating a technology silo that was divorced from the rest of our care continuum. We selected Carina as our operating partner because they offered a new way to get the support we needed, both technology and a virtual provider network, while working as a part of our integrated network under our brand and meeting and exceeding our clinical standards. Let's take a look at the structure of Anytime Care on the next slide, and then you can see how it works. Let me walk through the steps to delivering a virtual care visit. Just like opening the doors to a new brick-and-mortar clinic, we have to tell consumers how to find us. We run coordinated digital and traditional marketing campaigns to keep Anytime Care top of mind for consumers so they think of us at their time of need. We also reach consumers who are searching for health information or on-demand access using search engine optimization. Consumers visit Anytime Care online, by mobile app, or by phone. The platform is designed to route each consumer to the best care for them. We ensure they understand which symptoms or complaints can be managed virtually so we don't disappoint. Virtual visits are delivered then by the patient's video platform of choice, whatever they are comfortable with, or by phone if appropriate. And then we rely on Carina's providers to staff those visits. After the visit concludes, there is follow-up work to ensure the optimal outcome. Clinical information about the encounter is shared back to HSHS Medical Group to ensure continuity of care. Again, recall that that's what we want to do, is build new patient relationship. And so our follow-up workflow includes identifying the patients who do not currently have a MedGroup PCP and extending them an offer via scheduling or just continued communication. For us, success of the program isn't the virtual transaction. It really is the new relationship that we build. Let me spend the next 2 slides showing you a little more detail about how we ensure that consumers have an excellent experience that can serve the start of this relationship. I'll touch first on the clinical governance and then on what you might think of as brand governance. We want to take care of these consumers for the long haul. It is not in our best interest to open the doors to a pill mill. We needed thoughtful attention to clinical quality, and the quality guidelines needed to have some teeth in the form of robust clinical governance. The clinical guidelines in place for Anytime Care were developed specifically for the virtual clinic, based on on-demand primary and urgent care encounters. Carina providers follow a quality assurance process within their provider organization, with as-needed case review by our clinician leaders. A recent review revealed 96% of visits adhered to these rigorous guidelines. Any of you who work in a reduction in care variation as part of your quality improvement will know that this is an adherence level to be proud of. Just as we pay close attention to the patient's clinical experience during the visit and the quality of the information passed to our physicians, we also pay close attention to the consumer experience, from the first moment of awareness of the service to their experience after a virtual visit. It was important to us that all consumer-facing experiences with the virtual clinic be HSHS Medical Group branded and seamlessly integrated with the rest of our marketing collateral and digital platforms. I've shared a few examples on this slide. These are just a few of the selections on our full continuum of communications to the consumer that guide them to become a patient of HSHS Medical Group. There are many steps along the way on that journey, from independent consumers seeking on-demand care to an engaged HSHS Medical Group patient. In our next section, I'll take you inside the operations that make the virtual clinic deliver results. I think most of you on this call will appreciate the fact that our goal of earning new patient relations is linked to our mission for patient care and to the business case attached to this service. Virtual visits delivered in isolation do not magically turn consumers into loyal patients of the health system. To achieve our goal of acquiring and retaining patient relationships, we had to help our virtual clinic become fully integrated into our system's operations. There are 4 operating principles I'd like to share. On this screen, you'll see those 4 listed: lead data-driven improvements, connect with corporate marketing, elevate grassroots marketing, and enable seamless integration. Let's look at each of these in turn. Everything that follows in this webinar is predicated on high-quality granular data at our fingertips. When we talk about health systems engaging consumers through a quote-unquote retail strategy, we're really talking about helping our big, cumbersome health system work better for each individual consumer. Within the HSHS system, we have worked hard to integrate the medical group practices with the acute care hospitals. But there is a new front of integration required: the connection to the individual consumer. That adaptation of huge complexity of our system down to that moment of high-value convenient service for the individual.
Janine, it appears that your audio cut out for just a moment here. Are you still here with us on the line? I apologize to our audience. Looks like we just have sound difficulty with Janine. Let me get that back up and running for one moment. Please be patient. Janine?
Yes.
Yes. I think your audio cut out, but we hear you again. I do apologize.
What part did it cut out?
So we saw just about the first few points you were going through on the current slide. If you could just reiterate the last 30 seconds or so. Thank you.
Okay. To become as nimble as our out-of-industry counterparts, the Amazon.coms of the world, we need to learn to respond to the reams of data generated as consumers move through a virtual encounter. As the service line manager for Anytime Care, I keep a close watch on our dashboard, and I direct adjustments to ensure constant improvement. The data available at my fingertips cuts across the traditional operating silos of the health system. I get a glance at marketing data, advertising data, digital platform performance, clinical operating metrics, and consumer behavior. This comprehensive view and the required responses to changes and trends are a new capability for many health systems. The virtual clinic is the channel by which we are transforming our system's relationships to consumers. Part of that involves adapting to the current perception of our brand. To reach our goal with the Anytime Care Clinic, we need to tap into and extend our whole system's brand equity in the market. We did not want to start promoting a completely novel standalone service. We wanted our consumers to understand that this video platform is a new way to access HSHS Medical Group care that they trust. Like any large health system, we have a brand family comprised of our business organizations, the names on the letterhead, and the perceptions that are still held by the community. They think of our hospitals, St. John's, or over at Good Shepherd. Our approach to marketing Anytime Care then has to speak to our consumers on multiple levels. We need to teach consumers how and when to use telemedicine. We need them to know that our platform can be found through Anytime Care, and we need them to feel that our care is connected to our provider network. We work hard to align with the corporate marketing structures in place at each facility. Anytime Care is a brand extension for them, and Anytime Care should be represented as another element of their network. Tapping into our corporate credibility and community reputation is important, but it isn't enough to focus on top-down promotion. We also stay hands-on with bottom-up promotion on the front lines. When I say hands-on, I really do mean hands-on. That's a photo of me at a health fair, converting virtual care enthusiasts one person at a time. I found that there is no substitute for in-person conversation to educate potential users of the service. Access care through a virtual clinic is a new consumer behavior, and we have two goals: to help consumers learn to adopt virtual visits and to make sure that they know that they can get their virtual care from us. Our goals demanded more utilization than we saw in the earliest months of Anytime Care. Launching our employee access program turned out to be the boost we needed. Once employees tried the service, they felt confident recommending it to our patients. I like to think the van helped too. Let's take a look at our utilization trends overall, since I know this is a hot topic in telemedicine. What we have learned was that our employees are the best source of referrals into the public virtual care clinic. The hard collaboration work we've done has paid off. Opening access to our employees turned the volume way up. Our public visit volume doubled in the quarter that we opened access to our employees. Looking at that trend line and what I hear anecdotally, we believe that our colleagues have tried the service themselves, liked it, and had it top of the mind to recommend to their own personal network as well as the patients. We know that some of our colleagues have become real champions of the quality and convenience of the service. Our numbers are, of course, proprietary, but you can see the positive trend here. I'd say we've gained great traction in the market. We feel good about the trend line for virtual visit utilization, but I want to remind you all, that's not our end goal. The real goal is to convert those virtual visits into patients' relationships with our system. The workflow that happens after the conclusion of the visit is critically important to converting consumers into patients. By the time the patient has completed a virtual visit, we have the foundation of a great relationship in place. We have a treasure trove of consumer data about them. We know whether or not they have an HSHS Medical Group PCP relationship already, and we know that they had just had a positive experience under our brand. We strike while the iron is hot. A dedicated staff person reaches out to each eligible consumer to offer to establish an HSHS Med Group relationship by scheduling an appointment for them. This staff person has access to PCP schedules and can help each consumer fulfill their preferences about doctors. For example, location, the practice type, male, female, or the language spoken in the office. This is a handoff back into our system, along with the clinical information about the virtual encounter that prevents Anytime Care from becoming a catch and release program. We use a dedicated staff resource for this function now. Some of you may have that capability to automate some of this outreach and scheduling with centralized scheduling resources, but the consumer needs a follow-up invitation into the care continuum. At this juncture in the service, we are continuing to meet patients' needs. I'm sure I don't need to tell you about the health impacts of engagement in primary care, and we're meeting our own health system objectives to grow our patient population served. We're talking about 83% of the patients receiving care in an Anytime Care clinic. These are people with a current health need who are ready to engage with us, making this a natural continuation of an open conversation between them and our system of care. I've shared a lot of operational guidance with you. To recap, let me lift it up a little bit and reframe the lessons learned, taking a more strategic view. I hope these lessons learned help you think through the requirements of a virtual care partner or to optimize your virtual care operations already underway. Across this presentation, I've referred to our organizing goal to earn new patient relationships. This is not a soft target. This is the objective that we use to make investment, design, and operating decisions around Anytime Care. I'm calling it out here because in the market today, there are a lot of options for improving the consumer experience in healthcare. Those of you who work in the industry know that there is ample opportunity for improvement, but we also know that we operate in an environment of limited resource. For us, it's important to prioritize investments that create value for both the consumer and the health system. We know that a sustained connection to the health system is the way to value our consumers that will endure beyond the fleeting value created in a convenient virtual care visit. Our next lesson learned brings that to life as we designed communication strategies for consumer engagement. Convincing consumers that we are the highest value option for them as a health system is not as simple as just lighting up our website. It is not a case of if you build it, they will come. It is a case of explaining to each consumer on their terms why a virtual visit helps them, and then after fulfilling that promise, inviting them to stay on in a relationship with the medical group and in turn our entire health system. Again, these are new competencies for many facets of the healthcare systems. To describe the service in consumers' terms, using materials and channels that are matched to their preference, not ours, and understanding how they seek access point through online search, not how we think about access points to our system. We have configured the marketing and advertising effort to serve consumer needs individually at scale. It's working. We are on the hockey stick part of the utilization curve, and we're seeing evidence that if they try it, they do like it, and our virtual patient base will continue to grow. Colleagues continue to refer patients to the service, and we're seeing repeat visitors into the clinic, indicating that this delivery mode fits their lifestyle and their wallet. We survey visitors to the Anytime virtual clinics, and over 80% of them would recommend the service to family and friends. I'm sure you're all familiar with the same question on HCAHPS, and so you know that there is a score above many state averages for inpatient care. And it's not just about the marketing message. We are becoming more and more competent in consumer-centered care delivery as our virtual clinic matures. Opportunity to improve the consumer experience continues to surface across the many service points in our system. One of the improvements that we expected was borne out in our data. We know that over 60% of our virtual visits are delivered outside the operating hours of our urgent care facilities. For us, this is evidence that patients would previously had delayed care, visited an ER, or shifted the burden of a visit into their own work hours to accommodate our hours. We now serve those consumers at the time that they prefer. Improvements that unfolded inside our priority care clinics created a relief valve for periods of peak demand. I'm sure we've all had firsthand experience of entering an urgent care facility when the waiting room is just packed. We decided to create a dedicated space for Anytime visitors right there in the brick and mortar priority care facilities. When wait times rose, front desk staff now offer access to a kiosk, which is really very much like a patient room, or offer patients the option to complete a virtual visit on their phone in the car in the parking lot if they'd like. We are so pleased to be able to offer sick patients an accelerated path to care and not just take a seat. Anytime care performance shines here, with an average of a 12-minute wait time, far exceeded by a 20-minute typical encounter time. We love that our patients' care contact is nearly double the wait time. And one of our developing access improvements, we're finding that our system has pockets of underserved geography despite our best efforts to distribute system resources fairly. Our rural communities sometimes go between 3 or 4 days without a physician on site. To be able to offer patients a choice of access options extends service in a very meaningful way. So what are the next steps for Anytime Care? of course, to continue utilization growth through building of these relationships. We also want to continue with the data that were presented to measure the downstream impact and how those relationships are benefiting our health system, and to create revenue opportunities by anytime care access to our employee populations. In October, we started marketing to employer groups as a means to reduce claims and as to offer an employee benefit. At this time, we have seen several employee relationships develop. We're excited about the possibilities ahead, and we look forward to serving our region as a leader in virtual care. I thank you for your time, and at this point, I'm going to turn it back over to Ralph for a few closing questions before the Q&A.
Great.
Wonderful.
Thank you,
Janine.
Oh, sorry. Go ahead. We had a little mute, finger on the mute button. Thank you, Janine. I appreciate it very much. Jessica, I'm sorry. I'll go back to you.
Great. Thank you, Janine and Ralph, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. Our first question is, did you consider offering access to local employers?
As I talked about a little bit at the end of the presentation, we are presenting them to employer programs now. We just launched this model. It's being very well received in our communities as a way for employers to reduce claims, but also offer their employees a benefit, especially when they're having to offer high deductible health plans to their employees because of rising costs. Yeah.
Thank you for clarifying that. Our next question is, what was the impact on your PCPs?
Well, I tell you what, we worked very closely with Karina when we launched this program, and we had physician champions who were actually part of our provider network that helped us to message appropriately to our physicians so that they understood the value of the program, the overarching goals that we spoke to, and how it was going to open a new access point for their practices. Based on some of our preliminary work and that best practice guidance from Karina, we have definitely messaged the providers that we are an adjunct function to them, and we are going to help them grow their networks.
I will add to that question, Jessica. Let me just add another point. This is Ralph. That as Janine pointed out, that working with the medical group and helping them understand that the lion's share of the virtual activity is often from patients that are new to the system, fears that they're going to lose visit activity in clinic are usually addressed. And the fact that we are more converting new patients to become members of those patient panels is a real opportunity. And the variation in provider group response is also a function of compensation and how they're employed. Production employees, providers are going to be more sensitive to that. But we have been successful, and as we've been able to do here, really work with the HSHS team to understand that the virtual clinic is about getting them, keeping them busy, not reducing their visit activity.
Great, Ed. Thanks, Ralph.
That's a great point. Thanks so much. This next audience member asked, did you integrate with your EMR?
Yes, this is Janine. Very much so, because if we were going to offer them into our network as a patient and a patient relationship and offer them a continuum of care, the virtual visit summaries become part of our EMR. So as they meet with their PCP and advance in the network, that becomes a part of their history.
Thank you for clarifying that. Our next question is, can you share some information about utilization and physician adoption rates?
Share some information on physician And adoption rate?
Yes, can you share utilization and physician adoption rate?
Physician adoption rate. Can we further clarify what you're looking? We do not track physician adoption. You mean how well the physician is promoting it within their practices?
Definitely. Thanks for clarifying that a bit, and we can address that offline.
Okay.
For our next question, an audience member was wondering, does HSHS offer existing patients the ability to have virtual visits with their HSHS PCP, or do you see virtual visits as a mechanism to attract new patients only?
Of course, existing patients can have an HSHS anytime care visit, but it is not with their existing PCP. It is with the Carina provided providers. At this time, it's not with their current PCP.
Yeah, and I'll just expand to that. That's an implementation decision, how you choose to do that. And it varies from system to system. And I think in this situation where, as we've heard from Janine, the focus is really on that patient, earning that new patient and that patient acquisition, the extended hours of availability of the Carina network was really what triggered that. But using the platform from a system provider is a system implementation choice.
Great, thanks so much. This next audience member asks, have face-to-face visits decreased as virtual visits have increased?
No, they have not at all.
Thanks so much. Our next,
maybe to expand on that a little bit, when we look at the survey results, we see people that would have went to an ER, or they would have went maybe to a competitor if they had something open, or we also see people that say they would have done nothing. So it hasn't decreased our patient visits at all.
Thanks so much for clarifying that.
Mm-hmm.
Our next question is, have you been able to show ROI on the virtual care product?
We track our ROI, and in the early stages, it has not been a positive ROI, but we are trending towards that goal. I think it's probably like any adventure or venture, the startup. It takes a startup period.
Great, thanks so much. This next question is about how payments are managed, and this audience member is wondering whether you collect credit card on file information.
We collect credit card, debit card, or flex card at the time of the visit. We do not retain the information as part of the user profile.
Thanks so much. Our next question is, how is the encounter documented, and is it in your organizational EHR or a separate documentation system?
The providers at Carina are very good about completing a summary, which includes the medical history that they've obtained. It includes the diagnosis and the treatment option. That summary is provided to us here at HSHS Medical Group so that we can put it in our EHR, and it's also provided to the patient through their email user account so that they can access it and read it also.
Thanks for clarifying that. Our next question is asking, how do you deal with HIPAA issues for communicating with patients by unencrypted email or text message, for example, appointments or appointment reminders?
We do not text. The Carina platform as it is today, it's when you call, it's on demand. You don't schedule an appointment, so there's no text reminders necessary. And when you set up a user profile to use our platform at Anytime Care, your information is retained in that user profile. You have to go out and access it with your username and passcode. So there isn't an exchange outside of that of patient information. If for Carina to provide me the patient information, it is sent to me through what's called a SFTP interface, Secure File Transfer Protocol.
And then adding to that, just to add to that, Janine, any patient communication is done by secure email so that they can access their records. So nothing is sent via clear email or clear text.
Thanks so much. Our next question asks, are the providers utilized by Carina full-time physicians, or are certain markets utilize them locum tenens providers? And if so, is there a reason that these physicians can work from home?
Yeah, so I'll take this one, Janine.
Yep.
So Carina uses an employed provider model. So our providers are employees of Carina medical providers or other medical groups that are established in the various states that we operate. Carina adheres to the prevailing standards of the medical board established for each state of operation, and we assume that and we ensure that providers are licensed to provide care in the state that the patient is located in at the time of care. So part of the question that occurs during the intake and requesting care process is to determine where the patient is. Where they live is not sufficient to provide care. It's where they're located at the time they're requesting care. And the software platform ensures that providers in the delivery virtual clinic will only receive requests for patients that are consistent with that provider's licensure. So that is all managed as part of the operating infrastructure that's provided in the virtual clinic.
Thank you for clarifying that. Our next question states that there was a recent study done showing that having this type of care available leads to a net increase in medical utilization, and which may increase overall healthcare costs. This audience member is wondering, is this what you have seen also?
Have we seen an increase in medical costs?
Janine, I can take that question if you'd like on a broader basis, and you can speak to HSHS.
Right.
So, I mean, it's a great question. So the caller is actually referring to a study that appeared, a RAND study that appeared and was published in Health Affairs. Wired magazine also similarly picked up something similar to that. And our experience working in planned populations and in health system populations is that if you offer care as an integrated solution, the primary issue with that study was that patients receive care in essentially a fragmented fashion, and then they go on to seek additional care because it wasn't part of their, their care continuum or their medical home. We have not seen that activity or seen that problem when that care is provided as a connection to their health system or to their health plan, so that you're not fragmenting the care. Our strategy is, and our Carina's corporate belief is that offering care as an extension to the existing health system, the local health system that the patient is familiar with, is the right way to do that, and is the greatest opportunity to reduce utilization from additional capability. Janine mentioned that that in some instances when surveyed patients said that they would have maybe done nothing and stayed at home. So there is argument to believe that in some instances the availability of care will encourage care-seeking behavior. One of the reasons why we focus on longer visits is that one of the things we really dwell on is education and helping that patient understand their care-seeking needs and their requirements. And the fact that our visit durations are roughly 2 times the average visit duration give us the opportunity to educate that patient and do something other than provide them a prescription. An educated patient who understands their medical needs and their care journey and go on and use the appropriate resources is the best way to lower costs, and that's why we make education as important as treatment.
Well, the only thing I can add to that is, as anytime care manager, but also as an anytime care patient, is the education portion has, in my mind, has been over the top from the Carina providers when I've personally gotten care, and to reinforce that this is not fragmented care through the anytime care program.
That's a great point. Thanks so much. Our next question is, does Carina offer services to small independent hospitals?
Yes, we work with organizations of any size. In Washington, we've worked with the Washington State Hospital Association, and Oregon with the Oregon Association of Health Systems and Hospital Systems to put together programs for rural systems. I participate in the Washington Healthcare Authority Rural Care Collaborative. We work with large systems in large cities, and we really provide a continuum of services for organizations of different sizes.
Thanks so much. Our next question asks, are you filing claims to insurance for anytime care visits, or is this a cash-only service?
It really is a cash-only service, or through an employer program, what the employer pays. So it is not, there is no claims filed at all.
And to amplify, oh, go ahead, Janine.
I was going to say, at the end of the visit, we not only give the summary of the visit itself, the clinical summary, but we do provide a receipt, because what we find is there are plans out there, employer plans, that will reimburse, but it would be up to the patient consumer to submit that to their insurance for consideration.
Yeah, and I'll add to that, Janine, that's a very good point. As parity becomes more of a consideration, and there are insurance offerings, Carina does bill insurance when that's a local option. And as you pointed out, the extent to which the service is offered as a part of the health system, if we have the health, part of the health plan, then we can bill the health insurance plan if that's what we implement. And so there's really the range of services from credit card billed to insurance billed to a combination of credit card balance bill and follow-up through a typical TPA relationship. But that's a function of the program. One of the things we didn't talk about, we touched on briefly, is the fact that the virtual clinic can run 3 different types of programs: a program for guests, people for which we had no prior relationship, for members, people which we have eligibility information and plan information, and patients, people through which we have clinical information and insurance information. So it's really a configuration of the program and what the sponsor is really choosing to offer their patients.
Thanks so much. Our next question asks, what percentage of HSHS physicians opt in to provide virtual care?
What percentage of HSHS patients use that's a great question. As far as, this is what I can tell you, about 18% of the patients who use anytime care are existing HSHS patients. That number I have.
Great, thank you so much. Our next.
I was just going to add to that, Jessica. Sorry to interrupt. I think I'm not certain whether the questioner is asking whether HSHS providers are participating in the care delivery or not. The platform allows that, but in this case, HSHS is relying on Carina providers for the virtual care delivery, and the relationship between the virtual clinic is a referral into HSHS providers. Other organizations have implemented that differently, but to answer I think if I understand the question, I think in this case, no HSHS providers are delivering care in the virtual clinic. Is that true, Janine?
That's correct. So I think we had different interpretations of the question. Did we
I know, that's why I wanted to
somewhere did we answer that?
I hope so. Between the two of us, we answered it.
Great. Thank you both so much for clarifying that. Our next question asks, do you have plans to offer this service for other medical specialties beyond primary and urgent care visits?
Do you want to go first, Ralph?
No, why don't you, Janine, because I think the questioner is asking of you, and then I can speak generically of the platform.
Yeah, we definitely see this on our radar, part of our strategy. We feel that there are definite specialties that lend to a telemedicine platform. Karina, and I'm speaking a little bit here, is developing the platform that will allow us to still engage with Karina as a third party, but use them as we expand out, but it would be, in that case, it would be our specialist providers who would be providing the care. So that is a vision that we have here at HSHS.
And I'll expand on that. So our current view is with the primary care, urgent care offering is really to provide a different kind of service, which is an on-demand, unscheduled service. As you move into specialty care, the economics of providing unscheduled, on-demand specialty care doesn't make sense, nor given the current reimbursement rate for specialty care does it make sense for a specialty provider to reduce their reimbursement rate through virtual delivery. And then thirdly, we believe that the specialty provider is really the province of the health system, and that Karina does not want to be in the business of competing with the resources that are more appropriately provided by the health system, specifically their specialty care providers. So our view of the platform is to support multi-provider participation so that a specialty provider could assist during a visit with a Karina provider, and also to support scheduled visits for specialty providers so that we can support that workflow. Our workflow is really an on-demand workflow. Specialty care is really a scheduled workflow, and we support both of those in the platform.
Great. Thank you both so much for clarifying that. It looks like that's all the questions we have today. I want to thank Janine and Ralph for their excellent presentation, and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.